Hi, I'm Taylor Wallace with the Produce for Better Health Foundation, Think Healthy Group, and George Mason University. Today I'm going to give you some simple tips on how to combat COVID-19 through good nutrition practices. COVID-19 causes your body to lose potassium. In severe patients, we call this hypokalemia or low blood potassium. Many patients also have concurrent hypomagnesemia, which means low blood magnesium. Think of your body as a savings account for potassium and magnesium. The more you put in, the more you'll be able to use later. What are good sources of both potassium and magnesium? Of course, fruits and vegetables. Potatoes, bananas, and oranges are just some of the good sources of potassium that fruits and vegetables have to offer. Did you know that a potato and a banana are very similar in their nutritional composition? Another important nutrient not found in fruits and vegetables typically is vitamin D. Vitamin D seems to be very involved in helping to prevent COVID-19 infections and also the severity of the disease once contracted. Dark green leafy vegetables, nuts, and other foods that are high in magnesium are important because magnesium helps to activate vitamin D. I just published a commentary in the Journal of the American College of Nutrition that explains all this complicated biochemistry. Most Americans don't get enough vitamin D from food. And let's face it, with this quarantine, we're not getting adequate sun exposure either. Emerging research from over a half dozen studies clearly show that if your serum vitamin D levels are above 30 nanograms per milliliter, you're much less likely to contract COVID-19. Furthermore, levels above 30 nanograms per milliliter can also prevent some of the severity of COVID-19, like the cytokine storm that's induced. Magnesium is also highly involved in preventing inflammation, which is caused by the cytokine storm due to COVID-19. Dairy products are the major source of vitamin D in the U.S. diet. However, you have to consume a lot of dairy to get your requirement. So for most people, supplementation may be appropriate. If your blood levels are above 30 nanograms per milliliter, keep doing what you're doing. But if they're below, you may wish to take an over-the-counter supplement. Just make sure that you stay under 4,000 IU per day unless prescribed by a doctor. And remember, different supplements often have similar nutrients, so if you're taking a multivitamin and vitamin D, remember to add up how much vitamin D you're taking from each pill. Remember, you should always talk about your diet and supplement use with a registered dietitian or health professional. And remember, the most important thing you can do during this pandemic is to keep your body healthy by consuming half your plate as fruits and vegetables. I'm Dr. Taylor Wallace with the Produce for Better Health Foundation.